Welcome to the new topic Clinical Haematology Unit-1 Haematopoiesis. Haematopoiesis, blood cell formation. Haematopoiesis is the process of blood cell formation in the bone marrow. It includes erythropoiesis, formation of red blood cells, RBCs, regulated by erythropoietin. Leukopoiesis, formation of white blood cells, WBCs, for immunity. Thrombopoiesis, formation of platelets for blood clotting, regulated by thrombopoietin. Lab use in hematopoiesis. Complete blood count, CBC, assesses RBCs, WBCs, and platelets. Bone marrow aspiration/biopsy evaluates blood cell production. Peripheral blood smear examines cell morphology. Flow cytometry identifies different blood cell types. Erythropoietin and thrombopoietin tests measure growth factors regulating blood cell production. MCQs. 1. What is hematopoiesis? A. Oxygen transport. B. Formation of blood cells. C. Breakdown of hemoglobin. D. Digestion of blood cells. 2. Which organ is primarily responsible for hematopoiesis in adults? A. Kidney. B. Liver. C. Bone marrow. D. Spleen. 3. Which type of blood cells are formed in erythropoiesis? A. Platelets. B. White blood cells. C. Plasma cells. D. Red blood cells. 4. Which hormone stimulates red blood cell production? A. Leukopoietin. B. Hemoglobin. C. Erythropoietin. D. Thrombopoietin. 5. Leukopoiesis is the process of forming which type of blood cells? A. White blood cells. B. Platelets. C. Red blood cells. D. Plasma cells. 6. Which organ is responsible for producing erythropoietin? A. Spleen. B. Liver. C. Kidney. D. Bone marrow. 7. Which blood component is primarily responsible for clotting? A. White blood cells. B. Platelets. C. Plasma. D. Red blood cells. 8. Which of the following white blood cells is involved in allergic reactions? A. Monocyte. B. Eosinophils. C. Basophils. D. Neutrophils. 9. Which test is commonly used to assess overall blood cell count? A. ECG. B. X-ray. C. Complete blood count, CBC. D. Urinalysis. 10. What is thrombopoiesis? A. Formation of red blood cells. B. Formation of white blood cells. C. Formation of platelets. D. Formation of hemoglobin. 11. Which factor regulates thrombopoiesis? A. Leukopoietin. B. Erythropoietin. C. Thrombopoietin. D. Hemoglobin. 12. Which of the following is the most abundant white blood cell? A. Basophils. B. Monocytes. C. Neutrophils. D. Eosinophils. 13. Which of the following blood cells has the shortest lifespan? A. Platelets. B. White blood cells. C. Red blood cells. D. Monocytes. 14. Which organ plays a major role in fetal hematopoiesis? A. Spleen. B. Liver. C. Pancreas. D. Kidneys. 15. Which condition is caused by a deficiency of red blood cells? A. Hemophilia. B. Leukopenia. C. Thrombocytopenia. D. Anemia. 16. Which WBC type is responsible for producing antibodies? A. Neutrophils. B. Lymphocytes. C. Basophils. D. Eosinophils. 17. Which of the following is a function of hemoglobin? A. Clot formation. B. Oxygen transport. C. Fighting infections. D. Producing antibodies. 18. Which of the following conditions is characterized by an abnormally high WBC count? A. Leukopenia. B. Leukocytosis. C. Anemia. D. Thrombocytopenia. 19. Which blood cells help in removing dead tissue and pathogens? A. Monocytes. B. Eosinophils. C. Red blood cells. D. Platelets. 20-WHICH test is used to analyze bone marrow function. A. Liver function test. B. Bone marrow aspiration. C. Blood sugar test. D. ECG. Thanks for watching.